Hi, I'm Mary Ann Murray, patient advocate for 20 years, interested in improving patient safety and patient engagement. I'm currently the co-chair of Patient Safety Canada, which is now a program of the newly formed Healthcare Excellence Canada. I'm also a patient champion of the WHO's Patients for Patient Safety program and a working group member of the WHO's third Global Patient Safety Challenge, Medication Without Harm. I'm a member of the Medication Safety Coalition, who funded this project. And finally, it's been my privilege to be able to work on this project with Alice Watt, a true ally and tireless advocate for patient safety. Here you go, Alice.
Oh, thank you very much, Marianne, for those kind words. Hello, everyone. I am honored to be here today to present alongside Marianne about our project together about oxytocin. I am a senior medication safety specialist at ISMP Canada and also a hospital pharmacist by background. And I am truly delighted to be a part of this wonderful conference, listening and learning from all of you. ISMP Canada is an independent, not-for-profit organization dedicated to reducing preventable harm from medications. Our vision is zero preventable harm from medications, and our mission is to identify risks in medication use systems, recommend optimal system safeguards, and advocate for safe medication practices. Today's learning outcomes will be to learn about oxytocin and why it is a high alert medication, to learn about a pan-Canadian initiative co-designed with patients to create a resource about oxytocin, and to listen to a patient partner's experience on what it was like to be a part of the initiative. A high alert medication are drugs that bear a heightened risk of significant patient harm, even when used as intended. Oxytocin is a high alert medication. And what is it about oxytocin that makes it high alert? We'll tell you more during the presentation. But it was interesting that the mismanagement of IV oxytocin is HEROC's second highest claim theme for acute organizations. I'll ask Marianne to share a little bit about that.
When I heard that oxytocin use was one of HEROC's top claims, I was shocked. I was unaware of the dangers associated with the mismanagement of oxytocin and the frequency of preventable harm occurrences. I was keen to work on a communication tool that could assist in preventing serious oxytocin harm incidents.
Well, thank you very much, Marianne. Some of the examples of some of the claims that we heard caused hypoxic ischemic encephalopathy, which is a type of brain dysfunction that occurs when the brain does not receive enough oxygen or brain blood flow for a period of time. And that happened to infants that were given oxytocin while the mom was in labor. Some of the common claim themes were lack of patient awareness that oxytocin is a high alert medication, lack of healthcare provider awareness of hospital guidelines, and multiple gaps in fetal health surveillance, which negatively impacted the safe use of oxytocin, and inadequate and inconsistent informed consent practices and documentation surrounding IV oxytocin. And even among healthcare providers, it is not a well-known fact that oxytocin is a high alert medication. So when we did a literature search of information about oxytocin, we found a patient story, and we'd like to share it with you. This is Christy's story.
Hi everyone, my name is Christy Weber. I am a mom of an almost 5-year-old and 2-year-old twins. Both my birth stories with them and my short time working as a doula are what drew me to this project. I think it's so important that parents-to-be are informed and they know the right questions to ask so they can feel really confident making decisions for themselves. Especially now during COVID times where parents might not be able to bring their extra support people with them to the hospital. So I was really excited to learn that the next 5 questions to ask series was focusing on oxytocin. And because I had a somewhat less than positive experience with oxytocin myself, and I feel like a document like this really would have helped me avoid the situation that I ended up in, which was with the birth of my first. Of course, I was a first-time mom and a bit naive, and I did so much research, but I guess not enough. And anyways, after about 12 hours of laboring at home through the night, I arrived at the hospital and I asked for an epidural so that I could get some sleep. And a short while later, I woke up to see the nurse putting something into my IV, which later it turned out to be oxytocin. I guess with an epidural, quite often that slows down your labor, so they use oxytocin to augment the labor moving forward, which I understand now. However, I was never asked if I was okay with this. I was never given any information, pros, cons, time to think about it, time to talk about it, anything like that. It was just given to me without my consent. So that is about the time, well, not that day, but later, after I was reflecting back, is about the time that I learned how important informed consent is and what it is, and how this document can really help with that. A short while after the oxytocin was administered, the baby became distressed, and then we were informed that an immediate C-section would be required. No time for any questions about that either. We were asleep, the lights came on, scrubs were thrown at my husband, get ready, it's time to go, we're going for a C-section. Luckily, we were all fine in the end, but the hospital also required me and baby to be separated for 2 hours, and even now he's about to turn 5 in a few days, and that separation still really affects me. So looking back now, I'm not fully satisfied with how that experience went. It did, however, lead me to become incredibly informed and strong and able to ask questions for my next birth. And that led to me having a VBAC with the twins, which was really cool. But I really think that a document such as this one could open the lines of communication between patients and doctors and empower the women and their partners to feel in control of their birth story, which is really, really important. I feel like if I had at least made the decision to take the oxytocin based on the information I was given, I would have felt better with the results, because at least it was my choice. But I was not my choice, and so I really struggle with the results, even though we're all fine now. So anyways, I hope I can be of some assistance with this document. I think it's really fantastic, and I'm sorry I can't be with you today. Thank you. Hi.
So, as Christy's story stated, there was an opportunity to work with the Canadian Medication Safety Coalition to increase the role of patient as a partner in oxytocin safety. This initiative focused on developing a patient information handout that provides questions and answers about IV oxytocin's benefits and the risks. Then we formed a pan-Canadian advisory panel with patients and healthcare experts representing national organizations like HEROC, the Society of Obstetricians and Gynecologists of Canada, Healthcare Excellence, the Canadian Association of Perinatal and Women's Health Nurses, the Canadian Midwives Association, and other stakeholders to help develop and test this resource.
Thanks, Alice. I just wanted to add a bit from the patient perspective on this, that according to the WHO, greater patient involvement is the key to safer care, and engaging patients can reduce the burden of harm by up to 15%. The 5 keys to patient engagement are seen as patient engagement empowerment, collaboration and of expertise and knowledge, communication, transparency and trust, and education. Now, this project, I think, has hit all key areas. Patient voices were engaged from the planning stage, throughout the creation of the product, the testing, and they continue during the dissemination. And such engagement really helps create a tool that's easy for patients and their loved ones to read and to understand and to feel empowered to use, as it helps to reduce our harm. So I think it's done a good job.
Thank you, Marianne. Here's the patient handout that we developed in partnership with patients. And it goes through 5 of the key questions. First, what is oxytocin? Which here in the handout, it explains that it's a hormone produced naturally in pregnancy to make the uterus contract. And when the uterus contracts, it is called labor. Oxytocin is also a medicine that is given during labor if the natural supply is not enough. And then it goes on to explain why it is used and what are the benefits and the proper use of it, how it is given, and then what the risks are of oxytocin. And we had built in a chart that showed the risks to the baby as well as risks to the mom. And then the last but not least section would be monitor. What do I watch for? With a section at the below of the handout to have a space for notes and questions. And we hope that with these sections, it would give the patients and their caregivers enough information to make the right choice for them. So how we did this project was we first performed an environmental scan, a literature review, and a multi-instant analysis of oxytocin incidence. We established a pan-Canadian advisory panel to support the development of the resource, and then tested the resource with patients and healthcare providers using a quality improvement approach. Then we revised the content based on the results and the feedback of the pan-Canadian survey and made improvements to make it better. We also created an implementation guide designed to support healthcare providers when they're talking to patients about the use of oxytocin to start or advance labor. The literature and environmental scan revealed the use of standardized patient-friendly material to support informed decisions about IV oxytocin in labor was very low across the Canadian landscape. When we did the pan-Canadian survey, over 100% of the patients and over 70% of the healthcare providers found this patient handout to be useful. 73% of the patients and 78% of healthcare providers found the handout easy to understand, and there was an initial endorsement of 12 organizations, and further dissemination is currently occurring nationally and internationally. We have to say that though 70% of the healthcare providers found this patient handout to be useful, there were some that found it with the words and the risks to be too scary. And so it provided us opportunities to use wording that they would be feeling comfortable using, but also provide the patient enough information to make the right choice.
Thanks, Alice. I would like to add, or I guess reinforce the fact that 100% of the patients surveyed found this to be useful, and that none of the patients who were interviewed reported that they found the handout to be too scary. So this really highlights a divergence in perception of information sharing that sometimes occurs between patients and healthcare providers. We wrestled with this throughout the project, but we agreed that informed consent, patient engagement, and patient safety were paramount. Mm-hmm. We were really careful with the wording, but in the end, I think we produced a guide that would be helpful to patients to identify serious risk, as well as appropriate monitoring when administering oxytocin during labor and childbirth. It was a bit of a project, but I think keeping things in mind, we got there in the end.
Thank you very much. Marianne, did you want to talk about some of the collaborations as well?
Oh, thank you. I would just comment on the value of collaborations in this project. Without these collaborating partners, this never could have occurred. Collaborations, I have always found, are a lot of work, and yet bringing together different perspectives has been essential to the success of the project. We were fortunate from the beginning to reach out to Alice to become the project lead, and with her skill and commitment, she was able to gather together a dedicated group of this country's experts to participate in this project. So while the work was long and challenging at times, the end result was so much better because of the collaboration that occurred here. So thank you, Alice, for your perseverance and for helping to lead the way on this.
And I just have to echo the same with you. Thank you, Marianne, because your voice and patient perspective helped us guide the way for the handout to include all the risks and all the benefits needed for patients to make an informed choice. And so I'd like to say thank you to you for all your help and leadership as well. So some of the learning approaches that the learning approaches we found during this project that language matters when discussing risks associated with IV oxytocin. It's important to engage patients early in the pregnancy and to educate patients on what concerning signs and symptoms to report, and using the handout would be able to provide that information. What we found from Winchester District Memorial Hospital, which is a hospital that uses it, that staff like the easy to read and easy to follow format. And they have the documented, laminated, and available to be handed to patients whenever they are prescribed oxytocin for induction or augmentation. Lastly, I'd like to share with you medair.ca, which is an easy-to-use platform co-designed with patients and healthcare providers. It is used to report any medication errors or near misses, along with adverse side effects. I encourage all of you to help us spread the word. It is through these reports that we can learn to prevent errors from happening and share the learning through our safe medication use newsletters. And here's how you can sign up for these newsletters and stay informed about medication errors and how to prevent them. We'd also like to invite you to follow us on social media. We have ISMP Canada and Safe Medication Use accounts on Twitter and Facebook, and also LinkedIn. If you have any questions, please feel free to pop them into the chat box or email me, and I'd be happy to answer any questions that you may have. And also I can share any questions you may have for Marianne to her as well. Thank you so much for this opportunity to share about our project.